And good evening, each and every one of you, and welcome to this edition of the Your Health is Important Facebook Live broadcast. I am Dr. MJ Collier, your host, producer, and on-air personality. And we want to thank you for joining us this evening. We know that each of you have lots of places to go, things to do, but you have decided to come and join us because this is the only interactive healthcare forum that allows you, the caller or listener, to ask your healthcare questions. So thank you for being here today. We are ready, like Freddie the Rock Real Study. So again, I'm going to pick up on where we were with our last. This is a continuing series on human sexuality and having a great and dynamic sex life after the age of 50. But first, happy Nurses Week to all of the hardworking men and women, professionals that have dedicated themselves to a life of service. Nursing is a very, very difficult job, very demanding, and literally a calling, and almost it's like pastoral calling. You have decided to dedicate yourself to serving others, and you do so with a smile every day, oftentimes not appreciated, but I just want you to know that we appreciate you. So, ladies and gentlemen, in the scrubs and the crisp white uniforms, I salute you. Again, once again, Dr. MJ Collier saluting the nurses and happy Nurses Week. So, what I've discovered in conversations with friends, with patients, even other healthcare professionals, is that a lot of older people, and I'm speaking when I say older, 50 and older, and even those in committed relationships are not having sex at all. Again, not having sex at all. They have no sex life, no sexual relationships, even though they may be in committed relationships. While many couples may be okay with that, I have literally heard the patients say, we don't do that anymore. I'm through with that. I stopped. And I don't have to do that anymore. When I heard the words, I don't have to do that anymore, I was like, oh my God, that is a horrible circumstance and a way to look at sexual intimacy. That's to be a good part of your life. So many couples okay with that, but others are just distraught. They want to do whatever they can do to recapture their sexuality. I had a female patient that complained that she missed her old highly erotic sexual self. She said, I used to be a sexual dynamo, and now starting in my 50s, my sex drive just seemed to shut down. She states that when she does have sex, it's uncomfortable, it's unpleasant, she feels sore afterward, and is always tired. Another patient that was in her 70s notes that her husband, she wants to be sexually active, but her husband have withdrawn physical intimacy, and she has basically had to turn to self-pleasuring. So she has toys, she has basically her own hands and the fantasies in her head, but she craves intimacy from her husband. And understand that sexual intimacy does not necessarily mean penile vaginal penetration. It can just be touching, it can be cuddling, it can be stimulating in a variety of different ways. So there are many ways that you can sexually stimulate your partner, that you can satisfy your partner, that don't necessarily require that. But of course, most people want to have the good old traditional vaginal penetration, in out sex. Okay. There was a recent national poll on aging that found that men and women ages 65 to 80, only 40% still had an active sex life. And even those in long-term relationships, the number was 54%. So only half the people in that age group, 65 to 80, are having active sex. This is something we have to address. So men, if you're having problems with a low libido, you have little or no interest in sex, you're feeling tired and fatigued, you need to get on board right now. Go to the website lipodrops.com and get those lipo teas. And lipo tea, the most amazing product ever that will revitalize your love life and you. You'll have more energy, your testosterone levels will increase, you will have a sexual potency and able to obtain long, firm erections that are quite good and satisfying for vaginal intercourse. So I had a female patient that complained about having sex. She said she felt like she was rubbing her vagina on a carpet or sandpaper. She said she just felt raw afterwards. And then she had vaginal atrophy. And again, as we talked about last time, her problem, one, she needs to moisturize, and two, she needs to lubricate. And so moisturizing the inside of the vagina, which is a mucous membrane, is just like moisturizing your skin. When you have dry skin, you put lotion on. how more supple your skin is, how better your skin feels. It's not itchy. It doesn't feel raw. And your vagina is basically just a moist mucous membrane, a version of your skin. So you need to moisturize. And then when having sex, you need to make sure that you are lubricated well. And so you do not use oil-based lubricants. Everybody has that nursery size jar of Vaseline by their bedside, but that is absolutely the worst vaginal lubricant that you can use. Vaseline is like putting fuel on fire. It is oil-based. It's difficult to remove with soap and water, and it can cause infections. So you need to use aqueous or water-based lubricants like Astrolube or KY jelly. Those that everybody's familiar with. They have them everywhere. And preferably one that doesn't, not the ones that warm up. Those don't seem to have a good effect on a lot of women's vagina or males' penises for that matter. So just good old a regular KY, unflavored, unscented, and hypoallergenic. Virtually everyone can tolerate it, and it really makes your sexual experience different. So this patient, after she was able to resume a healthy sex life, after we started treating her with hormonal vaginal cream. This is a cream that you insert inside the vagina that women can get from their primary care doctors or their OBGYNs. It will make the vagina thick instead of it being thin and friable and fragile. It will be thick and muscular and able to hold on better. You will have more stimulation, which will enhance the quality and the intensity of your orgasms, ladies. So you want to make sure that if you have vaginal atrophy, and you probably do if you're menopausal, then you can use an estrogen replacement therapy. An estrogen cream is good. I spoke about bioidentical hormone replacement therapy, which makes the vagina thick, which makes the vagina moist, and makes the vagina receptive. It also makes your libido shoot through the roof. So this is the life-changing treatment that everybody should be able to get. So bioidentical hormone replacement therapy, BHRT, is something that Dr. Collier does in his office, but there are many providers that do it. You can just Google BHRT in my area, and several providers will come up, and that will be good for men and women. For men, it makes you a sexual dynamo. It makes you have longer, harder erections. It gives you a libido, again, that's out the roof, so you are matching your female partner, and it will allow you to have sex multiple times. And you can have round 1 and round 2 with no difficulty after you get bioidentical hormone replacement therapy. This is customized therapy that is unique to you. So the dose that you get is different from the dose that your friend, your brother, your cousin may get. So don't be surprised at that. When you get bioidentical hormone replacement therapy, a unique blood panel is drawn that evaluates your entire neurohormonal system. And then recommendations are made based on those results about what you need to get as far as your replacement is concerned. That data is entered into a computer algorithm, and then the computer designs a pellet program that is unique to you. So I have inserted as few as 1 pellet in a patient and as many as 14 in a patient. It depends on what you need. So don't be impressed by the number. The number is not important. The quality and the types of hormone replacement that you're getting is what's important. So again, Google bioidentical hormone replacement therapy. That's for men and women. For the men, we have the Lipo T product that is available on our website right now, lipodrops.com. And then for women, the women ask me, do you have a product for women? And yes, we have had a product for women, but we stopped marketing it, and I'm going to bring it back. The product has what's called the maca, M-A-C-C-A berry, skin and juice in it. This maca berry comes from one place on earth, and it's an island, and everybody on that island, one, looks good, is young, they're having great sex until they're 7th decade, 8th decade, 9th decade. They're living a long, long time. So they were trying to figure out why was this the case. And what they found out was that these people are consuming this maca, M-A-C-C-A berry, and that it is having a very strong effect on their sex drives for the men and the women. But it works phenomenally in women. So we're going to have that product available soon, ladies. So look on our website, lipodrops.com, and when you see the Lipo E for women, the Lipo E product is what we're going to call it. That's going to be the product that will change your sex life. But for the men right now, the Lipo T and I've gotten questions about the lipo tea since we spoke about it. The lipo tea you can take if you have high blood pressure, as long as you're taking your blood pressure medication. There are no stimulants in it, so it should not cause your blood pressure to go up. And then the dosing regimen is take 2 or 3 capsules. You're not looking at milligrams here. It's 2 or 3 capsules. So I recommend that most people take 2, see what kind of response you get. If you're not getting a response, you can take 3. And each bottle has 90 capsules in it. So if you take 2, it'll last you 6 weeks. If you take 3, it's only going to last you a month. So 2 does it the vast majority of the time. So this is not a circumstance where more is better. You start taking 2, you take them after dinner or before bedtime, anytime in the evening after you've eaten. And just after you've been every day will be better than the previous day. This is not a product that's like Viagra, Cialis, Levitra. You don't take it 30 minutes before you get ready to have sex. You take this every day so that you're always ready to have sex. And guess what? When you're always ready, you have more sex. You have more quality. You have a higher quality of sex, a better quality of sex. And that's what you want out of your lifetime. Okay, Havoc, let's go to the roll call. Who do we have on right now? Let's see who you are and where you're logged in from. Sherry Gamble from Dallas, Texas. Hey, Sherry, good to see you again. Okay, Sean Big Time Green, my man, Sean, I hope you got that lipo tea. I want you to tell me about it. Velma Austin from Clinton, South Carolina. Velma, thank you so much for joining us. Keith from Jacksonville, Florida. Hey, just left Jacksonville. Paula Hawthorne Bond, happy hump day from Greenville. You're right, it's Wednesday. Felicia Rames Simons Cunningham. Hello, and where are you from, Felicia? Rachel Harrison from New Orleans is in the house. I love New Orleans. You know that. Sherry Warren, hello from Canada. Oh, the Canadian is back in the house. Okay, Sherry, thank you for joining us. Miss Makiba Boland, thank you for joining us from Douglasville, Georgia, just a suburb of Atlanta. Okay, Tanisha Acree from Delane, Florida. Delane, I lived in Delane for a while. So we are glad that you are there, and we are glad to see you. Okay, Chris Goodjoin. Carolyn Brown from Michigan. Thank you, Carolyn, for joining us this evening. Okay, Lord L. Taylor Sr. Okay, good evening from Dr. Kaiser. Listen, Barbara Brown from Chicago. Chi-Town. Thank you so much, Barbara. Deborah Mathis from Denton, Texas. Texas is in the house. Glenn Williams from Jacksonville, Florida. Thomasine Morris from Birmingham. Birmingham in the house. Thank you very much. Okay, Mimi Witcher. Good evening. Hi, Mimi. How are you? Thank you for tuning in. Kanisha Coates from Nitchatoches, Louisiana. Okay, Felicia Regina Simone Cunningham from Jonesboro, Georgia. Hey, Felicia. Okay, Rosemarie from Pittsburgh, Pennsylvania. Hey, Rose. How you doing? Renisha Robinson McMillan from Dallas, Texas. Okay. And Sharon Price Bingham. Hello there, Sharon. Thank you for tuning in. We appreciate you. Yolanda Turner from Fort Valley, Georgia. Okay, first person from Fort Valley. Okay, the Nika Galbraith from Tulsa, Oklahoma. Tulsa, first timer also. Felicia Galmer from Gaffney, South Carolina. Thank you, Felicia. Elaine Power Snell from Miami, Florida. Hey, Elaine, how are you? Ivy Bowie from Rocky Mountain, North Kakalaki. Okay, we good now. Okay, Laverne Jackson from Mount Dora, Florida. Hi, Laverne. Okay, thank you so much. Havoc, let's get to the questions. This is your show. We're here to answer your healthcare questions. So let's get to it. And again, anybody want to respond to the comments that we've made about sexual health, if you have any questions along that line, don't hesitate. This is an adult conversation. We are happy to address any concerns that you may have. And remember, if the problem is that you feel like you're not your sexual best because you got a few extra pounds, all of us do. Guess what? That lipo drops max formulation, 1 dropper full under your tongue before each meal, and you will find that you will drop that excess body fat, lose the muffin top with lipo drops. We'll have you back super sexy in no time. You'll be beach ready, beach body. Just you have time now. We'll start in the beginning. We haven't had our first holiday yet. If you start taking lipo drops now, by the time you get to the 4th of July, you will have dropped a substantial and significant amount of weight. But it doesn't take a lot. Just 10 pounds is a dress size and can make a difference in how you look and how you feel. 15, 20 pounds, now we're talking 2 or 3 dress sizes. And for men, 1 or 2 belt notches in how you presenting yourself. So you don't have that Dunlop syndrome and all that excess abdominal fat that takes away the blood flow that you need to have a long and a firm erection, because the mechanism of erection is one of blood flow. So when you have good blood flow going into the penis, you're going to have a longer, hard erection. When your blood flow has to support excess abdominal fat or any fat in your body anywhere. That's blood that's being wasted that could be going toward a healthy erection. So you lose the weight, you lose the body fat, and you're going to have that. And remember, the weight that you lose, the vast majority of it with the LipoDrops product is going to be fat. We want to lose fat, not under normal circumstances. When you lose weight, you're going to lose about, for every 15 pounds, 10 pounds of fat, 5 pounds of muscle. But when you gain it back, it's all fat. Our objective with the LipoDrops product, which changes the way that your body metabolizes your food, your weight loss is 95, 98% fat only. So you don't lose any muscle. And so you still have strength. You get muscle definition by fat that you are dropping the weight. So get the LipoDrops Max, 1 drop of food before each meal, and you will accomplish your objective. Get Beachbody ready. Okay, next question, Hamlet. Okay, Chantel Harper, 48 years old, weigh 341 pounds, have high blood pressure, arthritis, degenerative disc disease. I had a blood test and nothing that contributes to my weight gain. What do you suggest for the pain in my back? Okay, one, weight loss will help tremendously. The weight on your back is like a wedge, and so it's pressing down on those discs in your back, and as you lose weight, you get more space, the disc relax, and you get pressure off of those nerves. So the simple and elegant solution is that. Amazingly enough, most back pain does respond to physical therapy. In equal amounts or greater than people that have surgical repair of these degenerative disc diseases or ruptured discs. So it's better to do conservative therapy, which would be anti-inflammatories. Prescription anti-inflammatories would be ibuprofen or Motrin at the 600 or 800 milligram dose, 2 to 3 times per day. Naproxen sodium or naproxen at 500 milligrams, 2 or 3 times per day, which decreases inflammation and promotes healing. Natural anti-inflammatories, our vitamin D product at a dose of 5,000 international units per day. And then the omega-3 fish oil, which kind of oils those joints and helps you get through that pain and inflammation. Omega-3 is a natural anti-inflammatory as well. So you want to be able to lose that inflammation, decrease your body's inflammation, and that will make you feel better. But getting down, if we could get you down 10% of your body weight, your life would change. And you can do that using the Lipo line. So you need to go to the website, look at the options that are available, because you're going to need a package. You're going to need, the Keto Max, the LipoDrops Max, possibly the cleanse and probiotics. And again, that combination of things will optimize your weight loss. You'll lose the most weight in the shortest period of time. And so that will work. And again, there will be a diet plan included with those weight loss products. And the 2 diet philosophies that we utilize, intermittent fasting, which means you eat everything that you're going to eat within 1 8-hour period during the day, or you go to the 5 meals per day, breakfast, lunch, and dinner, a snack in between breakfast and lunch, and a snack in between lunch and dinner. And that way your body never feels hunger, and therefore you will not store food as fat because you are putting fresh fuel in your body on a continuous basis. So that is why that diet works so well. All right, next question, Abbott. Okay, hope for nothing less. Oh, I love that. It feels like a peppermint coming through my airways when I breathe for the last 3 years. I've had a scope, throat, lung x-rays. Doctors don't have a clue other than acid reflux. So don't discount the acid reflux. That's probably the issue, and that you need to utilize anti-acid products. In your case, you need to use H2 blockers or proton pump inhibitors. The H2 blockers of choice now would be Pepcid or famotidine. You need a dose of about 40 milligrams. You can take that once or twice a day. That is prescription strength. That is available over the counter, half that strength. The Pepcid AC product is 20 milligrams, or a proton pump inhibitor product such as Protonix or omeprazole. Those are products that, again, over the counter at the 20 and 15 milligram dose, but the prescription strength is 30 and 40 milligram doses. And so, previously, doctors would place you on these products and say you only take them for 6 weeks. People would take them for 6 weeks, get great response, and feel much better. Then doctors say, well, you got to stop taking it now. And so what would people do? Would they stop taking it? No, they changed doctors, because there's been no long-term studies that show continuous use of H2 blockers or proton pump inhibitors, PPIs, cause any problems in the albino rat number 135 or whatever the number is, they found some kind of gastric tumors, but this has not been the case in human studies. So sometimes animal trials do not translate to humans. There have been no problems with this. So people are taking these medications continuously because they need relief from that. You also need to be checked for a hiatal hernia to see if that is the problem, and that may be. And if that is repaired, then you might no longer have gastroesophageal reflux disease. So again, taking those types of products to keep the acid continuously suppressed. I also like to add probiotics so that you have a good positive GI flora, so that the bacteria and the biodome in your stomach is a positive one, and so it won't cause foul breath, bad breath, etc. And then I like to do things like coat my stomach with yogurt. Greek style yogurt has the highest amount of probiotics, or a brand name that you're familiar with is Activia. It comes in the little green yogurt cups with multiple flavors. Doesn't matter what flavor you get, that has nothing to do with the probiotic content. So keeping yogurt available and around to coat your stomach, and then making sure that you don't eat anything within 3 hours of lying down to go to bed. It's just the physical aspect of lying down will cause you to have reflux. You get reflux, and then you get irritation in the airway that can last you beyond that day to the next day, etc. So you have to be constantly and continuously vigilant about avoiding irritating your upper esophagus and the back of your throat so that you don't have those problems. Okay, next question. Richard Van Leeuwen. Okay. Hi, Doc. How long before you feel the effects of lipo T pills? Every day will be better than the previous day, depending upon what your deficit is. Most people start to get optimal benefit after a couple of weeks. But again, if I take one today, I'm going to be a better person and feel better and act better tomorrow. But after you've been on it for about 2 weeks, you really will notice the difference. If you've been on it for 2 weeks and you're feeling some benefit, but not quite where you want to be, then you go up to 3 pills per day and then stay the 3 pill per day dosing until you're optimized. At that point, you could probably go on a maintenance dose of just two capsules per day. Okay, great question, Richard. Okay, Kanisha Coates. I had a full hysterectomy a few years ago, and I've gained a lot of weight and my hair is thinning. What can I do to combat this? Kanisha, you need bioidentical hormone replacement therapy. It will change your life. It will help you lose weight, help you increase your libido, increase your muscle mass, decrease your body fat, help with the hair thinning. All of the problems that you have are due to a decreased female hormone presence. You need some estrogen. And since you don't have a uterus, you won't need progesterone. But you don't want to take the estrogen products that are available via prescription from your traditional providers. You want to get the bioidentical hormone replacement therapy. That is the state of the art and what everybody needs to be doing to optimize their neurological and hormonal health. It basically just gives your body back what it had in the past and what it continues to need. The problem is that oftentimes after a procedure like that is performed, they don't put you on hormone replacement therapy, and you go into a deficit and you start to have those problems that you have noted: the weight gain, the hair thinning, the decreased libido. And so you can recapture that by restarting hormone replacement therapy. But again, you don't have to go through that, ladies. So if you are contemplating having that procedure, and it's the most common surgical procedure for women, is hysterectomy due to fibroids, excessive heavy bleeding, uterine cancers, all types of issues that ultimately result in you getting your uterus taken out. And oftentimes they will take the uterus and the ovaries. When they take the uterus and the ovaries, you have no hormonal support in your body, yet your body still needs hormones. And it will take a while before you really start to feel the deficits, and it's a slow decline. But it's basically putting you in instant menopause, and that is the problem that oftentimes the doctors that operate on you don't address. They've taken out the problem, the pathology. They feel good. They say, I fixed the problem, and they're not willing to deal with the after effects of those surgical procedures. So a lot of women now are not so eager to get total hysterectomies or TAH because of the consequences of that action. They don't feel feminine. They don't feel like a woman. They don't have the sex drive, the passion that they had before. And it can change your personality as well because you're not being sexually satisfied. You can become on edge, edgy, difficult to be around, fussing at your spouse, your significant other, your children, just hard to work with, hard to be around your friends. And that is not your personality. And you know that's the problem. You're aware that this is not who you are, yet it's the way you're manifesting because you need desperately to have those hormones replaced. So again, look up bioidentical hormone replacement therapy, BHRT, near me. Dr. Kai would be happy to see you and talk to you about that. But there are providers, if you're not here in the local area, that can help address that to change it. It literally will be life changing. But once we have that Lipo E, the Macaberry product available is going to give you a lot of those benefits. There are other things you can do. If you go to a place like GNC or the Vitamin Shop, get one of those counselors in there to help you because there are some natural things that you can do that can help with that. There's a whole class of products called phyto, P-H-Y-T-O, estrogens. That's P like in Paul, phytoestrogens that are plant-based, but they give you the same type of hormone replacement that you can get from other products. So phytoestrogens work wonderfully in a lot of people. They don't work in everybody, but they do work in the vast majority of people. And that is something that you can do immediately. You don't need to see the doctor about it. You can just, go and talk to one of those counselors, see what they recommend. Don't buy everything in the store. Just get those things that make sense to you and see if they will make some differences. Give it about 4 weeks to see if it's starting to change you. It's not going to be one pill and you're fixed. No, and it's going to require continuous therapy. You're not going to people say, how long do I have to take this, Dr. Collier? Forever, for as long as you want to feel good, because it will be life changing. Okay, next question. Janelle Bell. In my colonoscopy, they found 3 polyps. All were removed, but one was sent to the pathologist, and it's a tumor, 4 millimeters. I go back next month for a mini colonoscopy. What are they looking for? Okay. They are looking for cancer, of course. And if it's cancerous, you want to remove it. If it's that small a polyp, they ought to be able to remove it in toto with no problem. And then you'll be cancer-free. Most polyps are precancerous lesions, meaning, either you cancer or you aren't. A precancerous lesion is non-cancer. So, but you take it out before it becomes cancer. Most people, when they get a colonoscopy, will have 2 or 3 polyps. They remove them while they're in there, thank God, because they used to just look at them, tell you they were there, come back, and then if it turns into cancer, we'll remove it. That ultimately resulted in people having to have part of their colon removed and colostomies. And everybody knows what a colostomy bag is. It's where your stool is no longer coming out of your rectum, it's coming out of a bag on your stomach. This is life altering in a way that you don't want it to be altered. So you want to make sure that you do follow up. It is very important that you follow up because they can zap it with a laser. They can use a wire snare and remove it. Either way, you're going to have to require, after they do that, you're going to require a more continuous vigilance. With a normal colonoscopy, you repeat it if it's perfectly normal in 10 years. If you have polyps, the follow-up period would be 3 to 5 years. If there's something unusual about your polyp, it is a really aggressive type of cancer, they may want you to do it every year. But for the vast majority of people, and that's who we're talking to today, then you're going to probably, if you have polyps, expect to get a colonoscopy every 3 to 5 years. If your colonoscopy is totally benign, once every 10 years. And if you've had a colonoscopy, you are not a candidate for the home products like Cologuard. Cologuard is great if you've had no screenings or you had a benign screening. Then you can use Cologuard, which is 98% accurate in detecting various types of cancers and it's non-invasive. You order a kit from the doctor, it comes to your home, you send the specimen in via US mail or UPS or FedEx, and they tell you within a week or so, whether you have cancerous lesions or genetically positive cancer cells. And then if that happens, then you're going to get a colonoscopy because you want to go in there and remove them. So again, the easiest to diagnose, easiest to treat cancer, but the least diagnosed because people don't want to go through those procedures. All right, next question. Okay, Danica, I'm anemic and can't remember how many units to take. I'm always tired. Okay, if you're anemic, you need to take iron or a complete multiple vitamin with iron and minerals. A complete multiple vitamin with iron and minerals, and that will probably be 1 or 2 tablets or capsules per day. They do have vitamins with iron as gummies now when doing so. But remember, when you take a vitamin or any other pill for that matter, it's very important that you take it with a full glass of water, not just a sip to get it down. Because if you, most of what we do, we get a glass of water, we take a sip, we put the pill in our mouth, we take a sip, we take another sip, and then we throw the rest of the water away. Even though we had a full glass of water, we don't drink it all. So now what you have succeeded in doing is you have a wet tablet that sits on the lining of your stomach. It gets sticky, it gets gummy, it won't break down. And so now you start to taste it, burp it, possibly even have a little nausea associated with it. And then the next time it's time to take it, you don't want to take it. You say, oh, that pill made me sick. The pill did not make you sick. Your pill taking technique is what made you sick. So very important, you take a full glass of water that will melt that tablet, get it out of your stomach and into your system in as little as 2 minutes. So very important to do that. Or you can just take it mid-meal. In other words, you start eating, you take the pill, full glass of water, finish eating, chance that it will definitely be digested and absorbed 100% then with no problems. But but what's important for you, because you're anemic, is that you get iron. Sometimes you have to have prescription iron tablets alone, but most of the time, if you take a product like One A Day for Women, Centrum, or Z-Bec, which are complete multiple vitamins with iron and minerals, then they will give you the benefit that you need, and you probably won't need it. If you have a severe anemia due to other reasons like thalassemia or sickle cell trait, you need to work with your healthcare provider to replace those blood cells with a more potent version, and which may even include blood transfusions or iron transfusions. Those are options as well. Next question. Denaron. Okay, Dr. Andrew, my wife is suffering from hives badly. Any multiple recommendations? Yes, yes, yes. If she has hives, and hives can be atypical, it sounds like that's what she's had. She probably has graphism as well. If you take her forearm and just scratch your initial on it, within a minute, your initial will come up as a hive. That means she's highly sensitized and needs antihistamine therapy. The problem is a histamine reaction. And so the first thing I would do is take a non-sedating antihistamine. The one that's best for skin is Allegra at a dose of 180 milligrams. If she's that sensitive right now, I would maybe take one in the morning, one in the evening. You can even load the dose by taking 2. And so when people are as distressed as your wife is, I say get the pills, and they're over the counter now. Take 2 of them in the morning and another one that night. Then the next day you can take one every 12 to 24 hours, depending upon how well your symptoms are controlled. The maximum dose for that would be 360 milligrams or 2 180 milligrams, but I like to spread them out so that your body's immune system is suppressed throughout the 24-hour cycle. Also, she needs to take cooler showers. Women, for whatever reason, love to take these steamy hot baths. And guess what? When you have that hive, urticaria is the formal name for it, a condition, a hot shower feels wonderful. But as soon as you get out and that cool air hits your skin, it starts a histamine reaction, and you're going to be itching for the next 4 hours no matter what you do. So you have to turn the temperature down in those showers. It's not as rewarding while you're in the shower, but it is very rewarding to get you through the night. Then also what's important is keeping that skin moisturized so it's not trying to break out. So I recommend various types of moisturizing skin lotions. One that's very inexpensive that I like to use is Suave brand, Suave, with vitamin E. But you can also use just vitamin E oil, because that moist skin has less of a tendency to itch and then stop it from scratching. So get that Allegra. My next choice would be Xyzal, XYZAL, a 5 milligram tablet, same dosing schedule, 2 immediately, then 1 that evening, roughly 12 hours apart. Then the next day, 1 every 12 to 24 hours. After that, Zyrtec, and then Claritin. Everybody has an antihistamine that they like and they swear by, but it's been shown scientifically through various studies that the Allegra product, which is fexofenadine, is the generic name. Fexofenadine has a much better effect for skin lesions. Okay, great question. TJ Martin, I suffer from anxiety and agoraphobia, which makes me get panic attacks. What do you recommend I use to ease my anxiety to help me calm? You would be a great candidate, TJ, for CBD oil. That will be something that you can do naturally. You just have to make sure that you're taking a high enough dose. I have seen CBD oil in as little as 200 milligrams 150 milligrams. That is a total waste of time. You're not going to get any benefit from that. We need to be talking about 750, 1,000, 1,500, something like that to help. Again, you want a pure CBD product that only contains the CBD and not THC. THC is the component of marijuana that makes you happy and high. It's also the component that you're tested for with a drug screen at your job. So you get a product that doesn't have THC in it. You'll get all of the benefits because all the neurohormonal receptors respond to the CBD component. And you get all the benefit without, again, feeling high or happy or putting your job at risk because you're getting drug screened. So try a CBD product. There is a brand called Rowdy, Rowdy, that is made by Grammy Award-winning performer Dallas Austin. His company, his record company is Rowdy Records. And so they have a health division now that I work with, and they have a version of CBD oil that you can get. So Rowdy, Rowdy, just Google it, and everything you need will pop up. Okay, great question. Destiny Alize, or Alizé, whichever one you pronounce it. Hey, Dr. MJ, I was wanting to know what I can do to heal and improve hidradenitis suppurative. HS, great question, great question. HS or hidradenitis is when you get these recurring boils under your arms in the axilla area. Oftentimes stimulated, they can just happen spontaneously, but happen oftentimes in women that shave their arms because they're shaving and making microscopic pitfalls or pits in their arm by doing so. So one, your shave technique is very important. So you should wash your underarm with an antibacterial soap such as Dial, the White Bar, or Libra 2000. You get a good lather going, wash, rinse the dirty off, then make another pile of the lather with the same soap, then use a shave gel, not a shaving cream, a shave gel, and get a good razor, multiple blades, up to 5. Not the ones that are 10 for $1 at the checkout stand. You need to get a quality razor. And men and women, whenever you shave down. So you go under your arm, you take one stroke down, you rinse. You take one stroke down, you rinse. You don't keep going over the area, and you don't turn that razor upside down or come up under any circumstances. When you do that, come upside down, or you keep going over the same area over and over, you're virtually guaranteeing yourself that you're going to have that problem. It can start off with an ingrown hair as well. Or like I said, this is where the glands, every hair on your body has an oil gland associated with it. That oil is called sebum. When you get a cystic lesion, it's oftentimes called a sebaceous cyst. And so the treatment of a cyst or an abscess is to open it and drain it. Sometimes when doctors don't get to it, the lesion under the arm will open up and start draining pus or sebum. But usually once it opens up, it starts to, if it wasn't infected, it now becomes infected. So there's also a prescription product that is now being utilized for hidradenitis suppurative, and it cuts down on recurrence. And for people that seem to be susceptible to it, that you can also get from your primary care physician, your family physician, your internist, or for ladies, your obstetrician gynecologist should be familiar with this product. And so that product is absolutely incredible as far as fixing recurrences. And so it is a biologic. It cuts down your body's immune response, and so that you're not going to have those lesions. But prevention is key. And the prevention, again, is appropriate shave technique, washing under your arms with a good antibacterial soap, because everybody underarm is laden with bacteria. And so a good soap. So it's one of the areas that we wash quickly. We wash everything else with enthusiasm. If we go under the arms at all, we do so very quickly and not thoroughly. And so that's a situation where you need to be more thorough to keep that bacteria count down. Okay. Okay, I'm back. Now, Renisha Robinson Macmillan, 41-year-old female with no sex drive whatsoever. I've had my estrogen, thyroid, and testosterone checked. Everything is normal, and I'm not premenopausal. What can I do? Well, Renisha, normal is sometimes not normal. Again, particularly with hormone levels. There's a range of normal with your hormones. Let's say if this is low and this is high, and everything between my hands is normal. This is low and this is high. Well, you don't want to be, you can be here on the low side, just barely inside that. And doctors will do the blood test and say, well, the blood test came back normal. And where at minimum, you want to be right in the middle of normal or on the high side of normal. So it requires aggressive treatment to make sure that if you have even if you're on the low side of normal, that you push and optimize your hormone levels. And so that is why you would definitely benefit from an assessment of bioidentical hormone replacement therapy. It will be life changing. You get a pellet today, you'll be different tomorrow. And after 2 weeks, all those things will go away. Particularly since your thyroid has been checked. And again, I like to optimize thyroid as well. Doctors seem to be very shy about pushing thyroid when it is one of the most beneficial hormones that you can have. And virtually everybody is on the low side of normal if they are normal. A lot of people are hypothyroidism, and that's when you start to feel fatigue, gain weight. Your brain is getting a little cloudy. And the problem is not that you're getting old, you have old age or whatever. It's not a function of aging. It's a function of low thyroid levels. So again, you push those thyroids up to the medium or on the high side of normal, life changing. The person starts to lose weight, their brain is functioning, their energy is at the Energizer Bunny level, and those are things that can be done. So you need to work with a provider that is familiar with those things. And you actually probably can get some good advice from a provider or a counselor at a place like GNC or the Vitamin Shop. Those people are trained to help with that. Or if you can find a naturopath that can give you that information, that's a doctor that practices, and uses supplements and herbs and all those things that you've heard about, that versus prescription medications. Or, of course, you can, again, contact Dr. Collier. We'd be happy to help you through that. Not a problem. But you can Google, bioidentical hormone replacement therapy near me, and just, and see if there are any providers in your area. If not, we'd be happy to do a consultation for you. Okay, great question. Next call. Deborah Davis, I have COPD, and I've noticed lately I have more drainage. It's dark in color. Does this mean my COPD is getting worse? Not necessarily, but change in color of your mucus and sputum usually means a change in the bacterial pathogens that is there, and probably infection. So you need to use, in addition to some of the great inhalers that they have out there now, they have inhalers that you use once a day. One of the ones that I like is Brio. Then they have one Trilipta, which has 3 different prescription medications in it, and then one called Breast Tree. That is the state of the art as far as inhalers are concerned. When you have COPD, using a maintenance inhaler is mandatory to optimize your health, and then using it correctly. Oftentimes, when people are using inhalers, they will blast the medicine to the back of their throat, and it never gets into the lungs where they need it to be because of inappropriate technique when using an inhaler. So you need to get firm instructions as to how to use it, so that you shake the inhaler up, you start to inhale, you stick the inhaler in your mouth, you keep inhaling, you hold the medicine in you don't blow it right back out, you hold it. 1,000, 2, 1,000, 3, 1,000, up to a count of 10. Then blow out through pursed lips. That way, you're not blowing all the medicine right back out. Pursed lips create a back pressure, so the medicine will stay in your lungs and not come out of your mouth. And you need to do 2 puffs, and you need to do 2 thorough puffs of the medication when it requires that. Some are 1 puff 1 time per day. So it's very important that you get that 1 puff down where it needs to be. So these medications work wonderfully, but oftentimes the problem is not the medicine, it's the technique using to get it. And then if you're having cough, wheezing, or shortness of breath, you need to use a rescue inhaler that contains Ventolin. That is the one you shake up. You take 2 puffs every 4 to 6 hours, or you use a home nebulizer, which has the same medication in it, and you just sit there and puff on that pipe to get that medicine slowly and gently down into your lungs. Once you get the lungs open, you need to get that mucus out of there. And so a good mucolytic. I personally love the Mucinex DM product. Not the D, the DM. The decongestant can dry you up and make that mucus like glue. So you don't want to get it stuck in your airways. But the Mucinex DM, the dextromethorphan, is the DM portion that is anti-cough. And then the Mucinex product proper makes that thick mucus thin and watery. So you can hack it up easily, get it out of your chest, and don't swallow it. Whenever you have mucus in your chest, whether it's from a cold, the flu, bronchitis, that is full of and bacteria laden. If you cough it up and swallow it, it's going to get into your intestines and give you diarrhea. or GI infection that you don't need and you can easily avoid. So you spit it out and wash your mouth out so that your mouth is not full of germs as well, using that mucolytic. And you have to use a therapeutic dose. The therapeutic dose of Mucinex is 1,200 milligrams, but it comes in as little as 400 milligrams. That is a total waste of time. It is not going to give you any benefit. So you want maximum strength Mucinex DM, which is available over the counter. And there are generic versions that are inexpensive, but the price varies tremendously. I've seen it for as low as $8 or $10. I've seen it for as high as 30 or 40 for the exact same product, depending upon where you shop for it. So these types of products are available in the stores where everything is $1, and in their generic forms, and you can get them and get the same benefit, saving a lot of your money. But also, these are products that are always couponed. So if you get your coupons out of your newspaper or go on the internet and find coupons, you can save a lot of money from that perspective as well. But with the diagnosis of COPD, you're going to need those products every day, forever. You'll never come off of them, and you want to optimize your lung function, because over time, no matter what you do, lung function will deteriorate. And you can slow that process down tremendously by making sure that you're using and taking all of your medications as prescribed. But if you have a change in the color of your sputum should be clear or light yellow. If it's dark yellow or green or brown, rust color, as they call it, those indicate various types of bacterial pathogens. And oftentimes that's not going to go away until you get a course of antibiotics, in addition to everything else that I've mentioned. So sometimes it will require you to get a course of antibiotics. And when you do, depending upon which one you get, make sure you take it through its full course. Don't stop when you start feeling better. When you notice that it's changed and it's lightened up, take it for its full course, because you don't want to decrease the bacterial load. You want to eradicate the bacterial load, and that requires a 7, 10, 14-day course of therapies with antibiotics. Okay, great question. Okay, Ms. Get Me. Okay, what is the name of the weight loss medication that doesn't give you the diagnosis of diabetes? That is Wegovy, Wegovy. The name of the molecule is semaglutide or semaglutide. It's pronounced semaglutide or semaglutide. That product, it comes in the branded name Ozempic, which is used for diabetes. There's another product called Mounjaro that also has a diabetes indication, but is seeking FDA approval for weight loss only. It works so wonderfully, and they noticed there's no denying that it works for weight loss. And we're talking about, 10 to 20% of your body weight. It's the oral version of a gastric bypass. It is that dramatic. But again, if you're not diabetic and you get this product on your medical record, it's going to indicate that you're diabetic. So that will rate you and make you more difficult to insure, or make your insurance much more expensive. But the Wegovy is strictly for weight loss, and it is the exact same drug, just with a different name. This makes no clinical sense, of course, but that's the way that it is. So you want to make sure that you get the Wegovy, Wegovy, the exact same drug, semaglutide or semaglutide, for weight loss, very effective. And then the Mounjaro product, again, which is right now strictly for diabetes. It works on 2 receptors. It is a more potent version and has more dramatic weight loss than the semaglutide or the semaglutide. But they both work wonderfully. You've seen people on the semaglutide. All your friends are on it that can get it. It works wonderfully. You see somebody who's had a dramatic weight loss, that's probably how they did it. We use that in Dr. Collier's weight loss clinic, but I found that I can get dramatic weight loss using the lipo line products as well, and they are much less expensive. The weight loss injectables that we're spoken about, anywhere from $1,200 to $1,600 for a 1 month supply. You can get the entire lipo line probably for 6 months for prices like that. So you want to make sure that you're accomplishing your objective. The lipo drops max, 1 dropper full under your tongue before breakfast, lunch, and dinner. For maintenance, just once a day before your largest meal of the day. Once you've lost the weight and you want to keep it off, then that's what Dr. Collier recommends. Okay, go to the website, lipodrops.com. Get your lipo products right now. Men, get that lipo tea, life-changing. You want to be great. You want to be the man that you were. You want to be, again, getting pats on the back from the lady in your life. Get that lipo tea. Okay, next question. It's me and not you. Can you take vitamin D if you're taking calcium? Yes, as a matter of fact, There are products that contain vitamin D and calcium in combination because that works even better to give you stronger bones and stronger teeth. It does not affect the immune system and the cancer prevention that vitamin D alone does. So the combination is better for bone health, is good. It's good and readily available over the counter. The problem is that in the combination products, the vitamin D dosing is not where you need to be. So remember, the therapeutic dose of vitamin D is always underdosed. They have vitamin D as little as 300 milligrams or international units. That is the unit of measure available, which do absolutely nothing for you. A lot of multiple vitamins will contain small amounts of vitamin D. You can't put enough vitamin D in a multiple vitamin because the pill would be too big to swallow. So the therapeutic dose once recommended by the FDA was 600 international units per day. Then they went up to 1,000. Then you could find 2,000 international unit tablets or capsules available. But what we have found is that the dose that gives you all the benefit, the boosting of the immune system, the cancer prevention, is 5,000 international units per day. But if you get your vitamin D level checked and you have a very big deficit, your vitamin D level normal range is 30 to 90 micrograms. So if most people I check, the vitamin D is under 10. That's almost too low to measure. They have no substantive vitamin D effects in their body. So you can even take 10,000. And there are 10,000 international unit doses available now that you could take daily. And then once you have felt that deficit, you could go to 5,000 international units per day for maintenance purposes. The vitamin D caplets that we have in the lipo line, the Doctor's D, are tiny little capsules. They are clear. They have no taste. They have no smell. They are very easy to swallow. They are about the size of a chiclet, but they're round. But very easy to swallow and are very good to take on a daily basis. My normal procedure is that when I wake up in the morning, I wash my face, I brush my teeth, I take the vitamin D, get that out of the way. Although it is better absorbed with food. The food that I choose in the morning is usually a cup of coffee. So that's probably good enough to get it absorbed. But even if you don't take it with food, you still will have it absorbed. It's very tiny, small, doesn't cause you any GI upset, no problems from that perspective. So the Doctor's D at the therapeutic and beneficial dose of 5,000 international units per day will be life-changing. Remember, Dr. Collier's trio for good health: vitamin D, omega-3 fish oil, and probiotics. Those three things will be life-changing. They will give you a quality of life and a quality of good health that has been missing from your life. And I take them every day, and they will make you feel just much better, from the way that you feel now. The omega-3 fish oil is an anti-inflammatory as well. It helps with joint pain. It helps with cardiovascular health. It helps prevent heart attacks and strokes. Benefits of fish oil are well known. And what's important is the quality of the fish oil product. So make sure when you open that bottle, those capsules are crystal clear. Ours are. And the bottle does not smell fishy. Ours do not. That lets you know when you have a cloudy product that smells bad, that's not a high quality product. It has not been purified, and you probably either not going to like it or not benefit as much from it because it's got a lot of things in there that don't need to be in there as far as your health is concerned. All right, great question. Next up, Simply Fly. I love it. My body was diagnosed with lupus in 2016. This is National Lupus Month as well, and I spoke about this on the Rickey Smiley Morning Show this morning. So I'm tired. I hurt so bad. Now I'm in therapy because of a disectomy in 2014. I need surgery. My L4, L5, she has a spinal stenosis, and that can cause weakness or pain in one leg or both legs. It can even cause problems with controlling your bowel or bladder. So you got a lot of things going on there, but you would benefit. Most of those problems, the problems with lupus, are inflammation. The prescription therapy for lupus is predominantly steroids. And so the problem with steroids is they make your blood sugar go up and they make you gain weight. They do give you relief without question. They work wonderfully in lupus. But natural anti-inflammatories can either replace the steroids or lower the dose so you have less side effects from them. Again, the two things I recommend: the omega-3 fish oil. With lupus, you need to take 4,000 milligrams per day. Our most omega-3 fish oil capsules are 1,000 milligrams, and so you have to take 4 of them. Ours is 1,480, so you could take 2 and be close enough to get your objective met and get you the benefits that you like. So 1 omega-3 fish oil in the morning and the evening, the vitamin D in the morning. That will decrease the amount of inflammation, improve your lupus symptoms. But probiotics will alter your body's immune response and decrease the body's autoimmune problem. Lupus is an autoimmune disease where your body does not recognize itself, and your own antibodies start to attack your skin, your organs, everything is being damaged by your own internal antibodies, which normally are there to help you. In this situation, they turn against you because they don't recognize self. It would be as if you got a kidney transplant or a heart transplant that didn't match and you started to reject it. Your body is literally rejecting itself. And so the steroids decrease your body's ability to have an immune response, and that is why you benefit from it, so less damage is done. But the damage that is done is inflammatory in nature, and that is why you need an anti-inflammatory. There are other new therapies available for lupus patients, but unfortunately, because it affects predominantly people of color, and there's not a lot, about 16 to 18,000 new cases each year. Predominantly people of color, also affecting men. I do have a male patient who is Caucasian with lupus. Unheard of. I didn't believe the diagnosis at first, but it is a diagnosis prevalent in him and it can happen. But traditionally, this is a disease that disproportionately affects women and disproportionately affects women of color. That's African Americans, Hispanics, Asians, higher susceptible to lupus than Caucasian females, but Caucasian women do get it as well. Okay, next question. Dr. Ray, should a patient receive shingles after they've had shingles? Okay, great question, Dr. Ray. And this is why. When the shingles vaccine, when the first shingles vaccine came out, it wasn't shingles. Shingles is the second iteration of the shingles vaccine. The recommendation was if you had shingles, you did not need to take the shingles vaccine because you already had it, you had natural immunity, and you probably would not benefit from it. Then the marketing changed, and they started saying, well, if you've had shingles, you don't have to take it, but you can take it. It won't harm you in any way. And that's true. I don't think that it causes you any damage, but the question is, does it give you any benefit if you already have natural immunity? Then the marketing changed again. Now, everybody's recommending that you get shingles or a shingles vaccine, not necessarily shingles, a shingles vaccine. At first, the age was 60, now it's down to 50. And guess what? The science of immunology has not changed. Our understanding of the science of immunology has not changed. What has changed is the marketing. So the thing is, if you would like to get the shingles vaccine, and this is the only vaccine that people come into my office and ask for almost on a daily basis. Now, I do have patients that come in and ask for tetanus shots because they know they need to get one every 10 years, but that's it. Nobody else comes in and asks for any other vaccine, possibly the pneumonia vaccine. I'll back that up. Sometimes my patients that are 65 years or older will ask for the pneumonia vaccine. But this shingles vaccine, I get asked about on a daily basis. And even by people who don't qualify for it because they're too young, because they have a family member, they heard about it. I guess the marketing, promotion, the commercials have gotten to them, and they want to get that shingles vaccine. It is a 2-dose regimen. You get one and you get the second one anywhere from 2 to 6 months after the first shot. Getting the shingles vaccine is not a pleasant. It causes a great amount of pain than traditional vaccines do because it has an adjuvant. It's got something in it that makes it more potent, and that causes more irritation. So you get more soreness of the arm, more pain at the injection site as soon as you get the shot. So what Dr. Collier recommends for any vaccine, for that matter, is that you start taking the day before an anti-inflammatory, such as Motrin, Advil, or Aleve. You take it as directed around the clock, the day before, the day of, and the day after, and also a non-sedating antihistamine that will decrease your body's response, inflammatory response, so it won't hurt as much, your arm won't be sore, but it does not limit or mimic or decrease your immune response. So that is what I recommended, starting with the COVID vaccine. But for any vaccination, the flu shot, any vaccine that a person is getting, I tell them if you prep your body with an anti-inflammatory and a non-sedating antihistamine, you will have greater benefit from that. Okay, Havoc, that will be our final question. We'll go with Julie Mack. No, I'll get the Julie Mack's question. You put it back up. I have a small nug on the right side of my chest on my breastplate. I did a mammogram, cardiogram, chest, x-ray, and MRI. They found nothing. What could it possibly be? I feel it, a lump of fat called a lipoma. If it was calcified, it should have showed up on one of those imaging tests. That means more than likely it is a benign lesion, and you don't have to worry about it. If you are continuing to worry about it, you can have it cut out and removed. Before I did all those tests, I probably would have just done that, or at least get a biopsy on it. But a biopsy is just a mid-step. You get a biopsy and they say, oh, it could be this, could be that. If they don't make a specific diagnosis, you still have the same question or concern. You cut it out, it's a moot point. You have it cut out, you remove, you don't have to worry about it anymore. So that's why Dr. Collier does not like to biopsy lesions. I don't care where they are. I just say just cut it out if it's easily accessible and it's not a major surgery to do so. If that's a superficial lesion because you can feel it, it probably can be removed under local anesthesia, and then you don't have that concern anymore. Okay, great show today. Thank everybody for all your questions. If we didn't get to all of them, you can DM us and we'll get to those questions and try to answer them on this and the next. Remember, we are here at 6:30 Eastern Standard Time on Wednesday evenings. Thank you for listening, and tune in to the Wellness Wednesday on the Rickey Smiley Morning Show at 8:20 Eastern Standard Time every Wednesday morning. Thank you for tuning in. We appreciate you so much.